What if the pill your doctor mentioned for depression is also being used to help prevent migraine attacks? That twist surprises a lot of people. And if your head feels like it keeps charging interest on pain, this video could change how you think about relief. Today we are talking about Nortriptyline for migraine headaches, what it does not do, and why some people find the long game more valuable than the quick fix. This is usually a preventive medicine, not the emergency button during an active attack. Migraine can feel like a budget crisis inside your body. One attack steals your focus, another steals your plans, and suddenly your week feels overdrawn. If that sounds familiar, stay with me, because the goal here is fewer attack days and more control. And before we go further, one important reminder: Nortriptyline is prescription medication. It is not right for everyone, and decisions about starting, stopping, or changing the dose should always be made with a qualified clinician who knows your health history. First, what is Nortriptyline? It is a tricyclic antidepressant, but doctors also use it in some cases for pain conditions and migraine prevention. That sounds strange at first. Yet migraine treatment often borrows tools from outside the migraine aisle. That is because migraine care usually has two lanes. One lane is acute treatment, which tries to stop or reduce an attack once it begins. The other lane is prevention, which aims to lower how often attacks show up and how hard they hit. So if you are expecting instant rescue, Nortriptyline may feel disappointing. But if you are trying to build a steadier life with fewer shutdown days, fewer canceled plans, and less dread about the next attack, this conversation starts to make much more sense. Think of it like protecting your future budget instead of chasing every emergency expense. Preventive treatment is about reducing frequency, severity, or intensity over time, and it has to be individualized. In other words, the right plan is personal, not copied from someone else online. Here is the real problem. Many people judge Nortriptyline too fast. They take it for a few nights, feel sleepy, dry-mouthed, or constipated, then assume the medicine failed. But early side effects and early results are not the same thing. With migraine, that misunderstanding can cost you. A preventive medicine is not supposed to behave like a fire extinguisher. It is more like installing better wiring in a house that keeps shorting out. You may not notice the benefit right away, but the system can become calmer. Some people also quit because they think, if I still got a migraine this week, then this is useless. That is the wrong scoreboard. The better questions are attacks less frequent, less intense, shorter, or easier to recover from over several weeks? And yes, side effects matter. Common ones can include drowsiness, dry mouth, constipation, dizziness, or trouble peeing, and some people need dose changes or a different option entirely. That is why tracking symptoms and staying in contact with your clinician matters so much. So how is Nortriptyline commonly used for migraine prevention? Doctors often start low, frequently at night, then increase slowly toward the lowest effective dose. One NHS migraine leaflet describes starting at 10 milligrams at night and increasing gradually every 7 to 14 days if needed. That slow build matters for two reasons. First, taking it at night can fit better if it makes you sleepy. Second, gradual increases give your body time to adjust, which can make side effects easier to tolerate instead of hitting all at once. Here is the part many people miss. The benefit may not show up for at least 6 to 8 weeks, and preventive treatment may be evaluated over months, not days. Another migraine handout advises staying on the dose for several months before deciding how effective it really is. So no, this is not a magic switch. It is more like setting up an automatic payment that quietly reduces future losses. The medicine is trying to change the pattern of migraine over time, not guarantee that tomorrow will be completely attack-free. The breakthrough moment is this. Success with Nortriptyline is measured like a trend line, not a single headline. You are not asking, did I get one migraine? You are asking, am I getting fewer bad days, less severe attacks, and less disruption across the month? That shift in thinking is powerful, because prevention is not a cure. Even strong preventive plans do not promise perfect control. What they can do is improve quality of life, reduce severity, and for many people, cut migraine frequency enough that daily life feels possible again. This is where a migraine diary becomes gold. Keeping track of symptoms, attacks, and patterns can help improve management, identify triggers, and show whether preventive or acute treatment is working. That is when fear stops driving the story and real data starts speaking. And remember, the best preventive plan is individualized. People with disabling or frequent attacks may be candidates for prevention, but the right choice depends on your pattern, your other conditions, and what you can realistically tolerate. Your goal is progress, not perfection. If you are discussing Nortriptyline with your doctor, go in with a plan. Ask whether your migraine pattern sounds like someone who might benefit from prevention, what starting dose makes sense for you, how long to trial it, and what side effects should trigger a call. Also review your full medical picture. Official drug information warns that Nortriptyline may not be suitable in situations involving certain heart conditions, glaucoma risk, seizures, urinary problems, pregnancy, breastfeeding, recent heart attack, or some medicine interactions, including MAO inhibitors. Practical steps help too. Take it exactly as prescribed, often around the same time each day, and do not double up if you miss a dose close to the next one. If you need to stop, do not stop suddenly without medical guidance. Then support the medicine with basics that protect your nervous system: regular sleep, steady meals, hydration, movement, stress reduction, and a realistic migraine diary. Medication works best inside a full plan, not as a lonely miracle expected to fix everything by itself. So where does that leave us? Nortriptyline for migraine headaches can be a useful preventive option for some people, especially when the real target is fewer migraine days over time, not instant relief in the middle of a full-blown attack. Watch for serious warning signs and get medical help fast if they happen, including irregular heartbeat, breathing trouble, rash, or sudden eye pain with vision changes. And if side effects become hard to manage, talk with your clinician instead of trying to tough it out alone. Quick disclaimer: this video is for education only and is not medical advice, diagnosis, or treatment. Always speak with your own doctor, pharmacist, or headache specialist before starting, stopping, or changing prescription medication, because your history and risks are uniquely yours. If you want more clear, practical health content like this, subscribe to the channel. And if this video helped, leave a comment with your experience, questions, or suggestions for the next topic, because your feedback helps shape videos that truly help people.